Hi, this is Julie with the CTL, and I am here with Mike Chaney. We are going to embark on some questions regarding PPE, the Cincinnati State Guidelines, and this will be posted on the Faculty Resource COVID-19 site in Blackboard. Welcome, Mike. Thank you so much for taking time out of your day. I know you're super busy to talk to us. I'm excited to have you because you are a respiratory therapist, and you know, who better to talk about PPE in the time of COVID. So Mike, as you know, we're doing some workshops called Teaching in the Time of COVID. And the very first one is going through some of the guidelines that Cincinnati State's requiring for both face-to-face teaching and coming on campus in general. And then also going through some of the questions that are swirling around out there about masks and other things. So if you could introduce yourself to us, that would be great.
Oh, okay. Well, thanks for having me, Julie. This is a great thing you're doing, and much needed for sure. So as she said, I'm Mike Chaney. I've been a respiratory therapist for about 27 years, and actually I still practice. I'm the program chair for the program at Cincinnati State, but I also still work one day a week in the hospital on Wednesday evening, actually. So I just worked last night. And I'm very often placed in the COVID ventilator unit, where I get to see and work with these patients. And I'm also a graduate of the Cincinnati State Respiratory Program.
We love that, don't we? I always love it when we have those. All right, that's awesome. 27 years as a practitioner, really. It's just a long time. Have you ever seen anything like this?
Not the pandemic level that we have. When Ebola was around, we got trained for that PPE, which was really, really intense. So the PPE wise, this is a step down, but certainly you're seeing much larger numbers. What it does to the lungs is not new. It's just a new trigger for it. But we're well familiar with the pathophysiology of this process. But no, we've not seen anything like this.
Well, you know, there's a lot of information out there, and I've been personally reading a lot. I know other people are too. I also want to point out that, you know, a lot of people are getting information in snippets, like when they're watching the news or even in social media like Facebook and others. And so one of the reasons to do this video with you is to kind of clarify some of that stuff. You know, we get bits and pieces of information. Oftentimes it's truncated to fit into a small, you know, 20-second segment on TV. And, you know, we're going to have people that are coming into campus, and it's important that they're informed a little bit more than that 20-second segment. And many people are out there reading things. We don't know enough yet about this virus. And so I think sometimes it can be confusing as the peer-reviewed studies and the small anecdotal things are coming out. So I look forward to having a conversation with you about this, because I think it's well needed. So
can I make one comment about what you just said, though?
Yeah, please.
I totally agree with you. People have to be really careful what they listen to, because there's a lot of misinformation or misleading information out there. And for just a couple of examples, I read an article, because I follow all this too. I read an article that said doctors are very worried about what the mechanical ventilators are doing to the body. And I had to laugh because it's always been an issue. The vents have side effects on the body. And so none of that is new. Somebody's just interviewed a doc who's, said, the ventilator can do this and this, and it's all normal stuff. Or all the ventilators that got sent to California that were supposedly broken when the batteries were run down and needed plugged in.
I'm with you there, because I was just listening to Brené Brown the other day about maintaining perspective. And I think that's really what we're talking about, is trying to maintain perspective. All these things, many of these things were going on in the world before, as you just mentioned, but it wasn't touching me. I didn't have an opportunity to have to know these things. When my mom had emergency open heart surgery, I learned an awful lot about respiratory care and things that were already there, like you just mentioned, the side effects. But the difference between life and death, when you're at that point, you're willing to accept these are some of the side effects that you need. So I think sometimes we lose this perspective. You can get locked into a single thing. Yeah, it causes damage, but there's a difference between causing damage and surviving and potentially not being able to breathe and therefore not surviving, right? We
Yeah.
take these risks all the time with every
Yeah.
medication we take and all of that. So that's a really good point. But yeah, I mean, you can get really locked into the rabbit hole of reading all these small pieces. So I think
Yeah.
maintaining perspective is a good note there. Okay. Well, where do you want to start? You want to start with masks, or you want to start with?
Yeah, so why don't I kind of give a really brief overview of the kinds of masks that are being talked about right now and how they think COVID is transmitted. So I'll just do a really brief overview. So if you look at the literature, one thing that we do know is that we don't really have enough data on a lot of things regarding COVID to be conclusive.
Yeah.
So that's where it kind of ties into what we were just talking about with, you'll read something and you'll think that's what it is, but really they don't know a whole lot. So, one of the ways that they know it's transmitted is through respiratory droplets, which if you've ever watched somebody talk in the light, and you see this spray coming out of their mouth and you think, oh my gosh, well, that's normal. You just don't normally see it unless it catches the light.
Yeah.
But those are aerosol particles, droplets. And so, those coming out can transmit it. Now there's much smaller particles. If you've ever sat on the couch with the light coming in the window and you're really bored and you see those dust particles and you're watching them and they float there for a really long time. And you think about a virus particle is even smaller than that. So those can actually hang out for a long time. And that would be more of airborne transmission.
Can I ask a
So,
quick question about that?
yeah.
So as
Mm-hmm.
I'm listening to you, one of the things I'm realizing is that I'm not sure that everybody out there in the world understands that it's about the size. Like you
Yes.
just described, that was the best analogy I've ever heard with watching the dust and the light, because it's hard to understand the tiny, tiny things that we're talking about because we don't really see those. But yeah, I mean, so large versus smaller, 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 smaller. And so the correlation is the larger the droplets, the less they hang in the air. The smaller
Correct.
the droplets, the longer they're in the air. And this helps us to understand why it's possible to have hours long things there that could potentially infect you, right? So it's the
Yeah.
size.
Yeah. And just to give you an idea of proportion, a dust particle is 10 to 20 microns on average. Now, I don't know how big a micron is. I know it's really small, but comparatively, if you can see that dust particle hanging there for a long time and it's 10 to 20 microns and a virus is just a couple microns,
Yeah.
proportionately, you can imagine how long that hangs there.
Yep.
So let's talk about masks. I'll talk briefly about just basic cloth coverings versus the surgical mask, which is, the non-form-fitting elastic loop around the ear that has the corrugated, that you pull over
I
your
should have
mouth.
brought
And
mine
then the
for show
N95.
and tell.
Right, I should too. And then we have the N95, which is the much denser, harder to breathe through, form-fitting mask. That would be the higher level. So those three masks, what they're recommending is a cloth covering. That would be the lowest level. And that doesn't really protect you from breathing the virus particles in. It's not really to protect you, it's to protect other people from infected aerosol coming out. Now, if you're thinking, well, I don't really want to wear my mask because I'm not sick, I would say to that they have found that you don't have to feel sick with COVID to be contagious.
Yeah.
So that's the big unknown. So they're just saying, hey, everybody wear a cloth covering because you don't really know if you're infected or not.
Right.
And so that will reduce those droplets coming out, which those droplets can travel really far. If you cough or sneeze, you got a cough coming out at a couple 100 miles an hour. And
Really? Couple
yeah,
100 miles an hour?
They can't, well, a couple hundred would be more like a sneeze. Those are faster, but cough, yeah, those are,
Wow.
really fast. And so they can travel, the large particles can travel really far.
And the small
And
ones even further, probably, right?
yeah, and they'll hang there. So,
Oh,
I
wow.
always, it's so funny because I always say I'm more nervous at the grocery store than I am working with COVID patients
Yeah.
because I get all these particles that may be hanging out there that I may be walking through, right? So, the distancing and the masks, those are more for the droplets. And like I said, that's to protect others from you. Yeah.
I just want to ask a question, or maybe let's chat on this a little bit.
Mhm.
Even if I suspect I have the flu and I go to the doctor's office, they make you, before COVID, they make you put on a mask, but it's not, I'm already infected. It's to protect the other people around me. And if we're used to understanding incubation periods, because if I encounter the flu, I don't get it immediately, right? I have a certain number of days, or depending on my immune
Right.
system, amount of time. So it's just that this one is a little longer than we're used to, isn't it? It can be as much as a couple weeks after you're infected that you're
Yeah.
potentially sharing.
Yeah, it's got an average symptom onset of I can't remember, 10 or 11 days,
Yeah,
something like that,
yeah,
up to 14 days.
yeah,
7 to 14 with an average of 10 to 11.
yeah,
But you might not know that you have it. So that's what the cloth coverings are for. And
right.
the surgical mask, the corrugated elastic looped ones, same deal. The N95 is a higher level mask that can protect you from inhaling things if it's fitted properly. Now, the CDC has recommended that the general public not use those simply to preserve resources for other people. People have different feelings on that. And certainly, if you're in a high risk category and you have to
Yeah.
go out, I think that is warranted for sure.
It's something I do. I'm in a high risk category. I have an endocrine disorder. And so
Yeah.
I'm super susceptible because I have all of the 100% of the underlying factors. And
Mhm.
so I do have an N95. But at the same time, I completely agree that if you don't have these underlying issues, certainly we need them for our healthcare workers. And, you just have, that's a personal choice, I think, that you need to make.
It is.
I do want to ask about the
Yeah.
medical
And I'm not
masks. Go ahead.
That's what I'm referring to as like the surgical mask.
Right.
It's got yeah, go ahead.
My question is, I've seen people wear them and the tutorials that say that you should crisscross um, the side as it
Mhm.
goes over your ear because it creates a bit more closure here. How do you
Mhm.
feel? Is that the proper way to wear a medical mask?
In the hospital, we never crisscross them simply because you're never gonna get a tight enough fit to
Make a difference.
make it. Yeah, because like I said, if the particles are airborne, they're gonna slip out the path of least resistance anyway.
Yeah. Okay.
And it's going to stop droplets whether it's tight back here or not. What I will say though about crisscrossing is I have a 12-year-old, and when he wears his mask out, he has to crisscross because his face is smaller, so it
Yeah, I
does.
have issues with my
Otherwise, it
ears.
falls.
My ears are
Yeah,
tiny, so I have to do it. Like I have to put it over my bun, and yeah,
right.
yeah.
Yeah,
But
otherwise it
ultimately, you should
falls.
be comfortable, right? Because you're going to be wearing this mask for quite some time. And so, I did want to ask a question, and maybe you're going to get to this about, people's fears about wearing the mask and having some health issues as a result of mask wearing. So I'm sure you're going to get to that, but you know, I don't know. Let's talk
Like
about it.
health issues, like what?
Well, I've kind of personally come down to this understanding that, I'm a biologist, so you and I having this conversation is a little easier for me, but wearing the mask itself doesn't have any physiological issues that I can define. Psychologically or mentally, sometimes people have some triggers to other trauma. Knowing that going in, then you just need to frequent break and you need to make sure that you isolate yourself and do those things. I've gotten rather used to wearing my mask. And it's just kind of a psychosomatic thing, like getting there. But some of these reports out there are saying that if you wear the mask, it's actually bad for you and all this stuff because you're recirculating your own air. And can we talk about that a little bit? Are you going to get carbon dioxide poisoning from wearing a mask?
Oh, that's a great question. So, I wasn't going to talk about that, but now that you brought it up, that's a really good point, and I'll address that. So, it does restrict airflow just a little bit, which for most people is not going to cause an issue. It's not going to wear your breathing out. It's not going to do any of that. Now, if you have lung disease or you're in an asthma attack or you have COPD, and you're having an issue with that at the time, that can make you feel a little short of breath and panicky. In terms of not getting enough oxygen in or not getting carbon dioxide out, that is absolutely no risk at all.
Yeah.
The oxygen is very small, carbon dioxide is even smaller, and so it passes through the mask very easily.
So that's definitely a fact-based, evidence-based, and we can debunk that, I think, today, because I hear that a bit.
Yeah. So, yeah.
People have run marathons with masks on during times of high pollen content if they have asthma. I've seen that.
Yeah. I mean, the N95 is a little bit harder to breathe through, but I can tell you when I'm in the hospital, if I'm not working with a COVID patient, if we're a COVID patient, I have like a battery powered filtration unit that, it's
the Ghostbusters thing.
And it blows cold air over my face. So I love it because I get really hot.
That'd be great.
But if I'm in a non-COVID room, I have to wear an N95 and I'll wear it for hours at a time. And other than, I make sure I chew gum so I don't have to smell my own breath for hours.
Yeah.
But other than that,
okay,
it's fine. I've not had any carbon dioxide retention.
I've had the question and I've seen it out there, so I'm glad we addressed it because somebody might ask about that. I mean, it's logical if you think about if you don't understand the size of the particles, like we talked about already, which is really good, and you just have never thought about that. Then you're not thinking about the pores of what you're wearing versus the size of the particles that you need and that you're expelling. So I think it's good to talk about it. Yeah. So, in terms of masks, I've seen people wearing their masks kind of like here. And so one of the things we want to make sure that everybody knows is that, a student can't wear a mask like this and say, I'm wearing my mask. It has to do this all the way down to your chin, right?
Yes. And my youngest son and I, we were out shopping today, and I always look around at how people are wearing their masks, and half the people have them down there. And I would say that it's almost useless. You may as well not even wear it because you are going to be exhaling, out your nose. And so if you're going to wear the mask, wear it properly. And that really is key. If things are going to work, they have to be used properly. So especially in the classroom where, physical separation is not going to be as easy as it is maybe in other settings. We can space 6 feet apart, but, people are going to be coming in and out for breaks, walking in together from the hallway. So they are going to probably be a little bit closer together than maybe they would in a store. And so the masks do need to be worn properly. And the other thing is, not just wearing, and maybe we're going to get to this later, but I'll just make a brief mention right now is, if you're grabbing your mask and pulling it down like that, and taking it off and laying it somewhere to either pick up infection or drop off infection, then it becomes more of a risk than it is a protection.
Yeah. So, I was going to say that, so the Cincinnati State guidelines state that both on the student personnel statement and the faculty guidelines that we have, that you do need to cover your nose, your mouth, and over your chin. That you should be sterilizing, washing your hands throughout the day. Obviously, we'll get to that. But yeah, if you're taking your mask off and on, and you're setting it down, you're picking it up, just as you described, you know, you need to have thought ahead of time, an intentional plan on how you're going to do that. So we have to take our mask off to eat. Say I'm social distancing when I'm eating. I want to make sure that I already in my mind have a plan together of how I'm going to handle that mask throughout the day. And I think that's an important piece to think about. It's no different than planning your lecture or planning your curriculum or your activities. It's a really important piece. We want to not touch our faces and our mask. And when we take them off, we want to make sure that we're very careful when we do that. Maybe even, would you recommend sterilizing your hands before you take it off and putting it in? How would you lay it? Like if you were on campus teaching, you were going to a break to eat something and come back, what would you do with your mask?
Yeah, so I take it off by the loops.
Okay.
Um, if you've been touching things, you really should wash your hands before you take it off.
Right.
Otherwise, you're potentially depositing stuff on your mask that you're going to lay on your face. So I take it off and then I fold it in half so that the part that's touching my face is on the inside.
Okay. And protect it.
And then, yes. And then well, when I'm at work, that's a really high germ place. When I'm at the hospital, I have a bag specifically that I will put that in.
I was wondering about like a Ziploc bag in your pocket. I've done that. So like I put a Ziploc bag in my pocket. So I sterilize and or wash my hands before I take the mask off. I do that and fold it and then put it in this bag in my pocket. I don't know if that's a good idea, but I don't like to set it down on anything out.
Yeah. You know, that's a really good question. And I'll tell you, at the hospital, they tell us not to put our mask in a plastic bag unless we clean it first, because
right. Well, yeah, because the bag is going to create
inside.
Yeah, but I mean, my thought is, I do close it in half. So that's a good point. So,
yeah. But to your point though, if you're not using the same bag every day, and if it's a Ziploc, you can grab a new one for the day.
Right.
And certainly, like you've said a couple times, what's the alternative?
Yeah.
Put it in a plastic bag versus lay it on the table, or loop it on your arm so that it's dragging places and bumping things. And
I've seen that, and I just cringe every time.
Yeah, for sure.
Yeah. So this is another one of those maintaining perspective moments.
Yeah.
I think what we need to do is, every individual person that's coming on campus should have a plan. They should have a plan for what they're going to do, and a plan that they feel confident and comfortable with. And, that also then every single day, the mask that you're using. So if you're using a medical mask, the second one you talked about, those get thrown away. We don't reuse those, right?
Yeah, it's up to your discretion, because I don't know how much access people have to medical masks.
Well, I'm not talking about, I'm just talking about the ones that are just the folded ones, the kind of the folding ones that we talked about. I'm pretty sure that the faculty guidelines say those are not to be reused, that if you have, that you have to, because unless you're sterilizing it, you can't launder them. And I think that's kind of their thought.
Yeah, absolutely.
So if you're wearing a cloth mask, then you want to launder that or sterilize that before you come back to school.
Yes.
And again, to your point, if you're going to, like I do my Ziploc bag, I take that risk rather than lay it out. If I'm going to do that, I'm not reusing the same Ziploc bag, right? I'm using a different one. I actually use a different one every time I put it in my pocket, but.
Yeah. Or like if I'm out, and this is what I'll do is, sounds really crazy, I'll designate a pocket that nothing goes in except my mask.
Yeah, that works too.
I'll fold it. Yeah, I'll fold it. Now, if I'm going to put coins in there, that everybody's touched, I may as well just, you know, wipe the coin on my lips or something, which
Right.
would be really gross.
Yeah.
But
Yuck. Yeah, or like the other thing that I thought of the other day, it just went through my mind. I was at the Walgreens, I think I had to go in to pick up a prescription, and that wasn't my plan. And I watched this kid do a thing, and what went through my mind is that is no different than you licking the outside of your mask. Like it was just horrible.
yeah,
But you know, here's the thing: we're not used to this level. This isn't something that we're thinking about all the time, and I think that just even taking the time to watch this video with you or to come to the workshops, to be intentional about a plan that we have, one is going to reduce our stress because we're going to have a way to do what we need to do. We're going to feel good because we know we're in
yeah,
compliance as much as we can. And that maintaining perspective, man, that's just so important.
yeah.
So let's talk about sterilization a little bit. There's lots of data out there on this, but let's talk about sterilizing our hands. So washing hands, gloves,
Mhm.
yes or no, and hand sanitizer.
Okay, so hand washing is, let me differentiate, because I think a lot of people don't understand the difference between hand washing and using the hand sanitizer, alcohol-based rubs. People think that soap is inferior to that, and I will touch on that. But when you use soap and water, it physically, you know, removes a lot of the bacteria and things, and it goes down, swirls down the drain, and it's gone. It doesn't obviously wipe everything out, but you know, a good portion of it if you wash your hands for 20 seconds.
Right.
Um, and then the
Or
alcohol,
the happy birthday song. That's what I like to say.
yes, or Twinkle Twinkle Little Star, whichever, you know, you prefer. I don't know. Does Yankee Doodle work too? I don't know. We'll
Yeah,
have to
probably.
sing it.
Yeah.
Okay. Maybe you have to sing that one a little slower.
Right.
So the alcohol or hand sanitizers, now that can kill stuff on your hands if, and this is the big if, it all goes back to using things appropriately. If you're just putting a little on there and, you know, doing that and you're done with it, you have to remember that maybe you didn't get under your fingernails. It's only going to kill where it touches. Now it may kill stuff, but it's still kind of there on your hands. And if you don't use enough of it for it to remain wet, I can't remember exactly what the guideline is. It might be 20 seconds or something like that, that your hands have to remain wet. Um, and if you don't get under your fingernails, then it's not going to be as effective. There is some studies to show that people are more compliant with hand cleaning with the rubs because you can carry it with you, and you know it's really convenient. You can put it in your purse, in your pocket, in your car, whatever,
Yeah.
and do that.
So one of the things I want to mention too that I've seen people do, and just see what your thoughts are on this, they'll use the hand sanitizer and they'll use it properly. Like I can see them really doing like the same happy birthday kind of thing, and they're trying to get into all the areas. And one of the things is if you have enough here and you scratch, you know, all that kind of stuff, you can get under there a little bit. You can't get it all. But
Right.
then with their hands wet, they wipe it on their pants or their shirt, or they touch something. And it's like, well, okay, what have you just done? You know?
Right. Yeah. There's germs everywhere.
So it's air drying, right?
Yeah.
Is the way
You
to
want it
go.
to remain wet. You
Yeah,
want it to remain wet.
right.
When I use the hands, I'm more of a soap and water kind of guy. I don't know. I just like the thought of washing stuff down the drain. But you know, if I'm in my car, I use that, and I never wipe my hands. I always let it air dry.
That's right. Yeah. And I'm going to concur. I do believe it's 20 seconds, and you want to be fully saturated. So the amount of stuff that you need to use is important. You know, we had talked about how you have to kind of cover everything. So if you're just using something that's not, you don't have a volume that you need, you're still
Mhm.
not going to, it's not going to be effective in that case either.
Right. And same with those little alcohol pads. You know, how much can you get wet with one of those? Not very much. So if you're wiping down your whole desk with one of those little squares, that's not going to cut it either.
Right.
And let me
That's right.
just say, I'm not you know, a respiratory therapist that's over the top, you know, condemning every practice, because until recently, I didn't even wear, I don't know if I should admit this, I didn't really wear a mask in public because I kept my distance, I washed my hands, I don't touch my face, and I'm not in a risk group. And so, you know, when the governor mandated it, I followed it because that's the right thing to do.
Yeah.
But so I want to put that out there because, you know, people may watch this interview and say, well, you know, he's over the top, he's a respiratory therapist. And I
Yeah.
want to say that I'm not mask crazy, and I'm not, you know, I don't love wearing my mask because I'm a respiratory therapist. I'm, you know, just a regular person outside of my job too. And I don't, you know, it's not my favorite thing to do, but I comply.
You know, and to that point, you know, when we're on campus, one of the biggest things that we can always do as instructors, facilitators, and employees of Cincinnati State is model. Like, you know, if we know what we're doing and we have a plan, like we talked about, and we have a way of doing things that gives us the best shot of preventing sharing our potential germs with others, then, you know, we should model that for our students. So, you know, whether, like, just like you said, I'm a regular person outside of RT. Well, you know, you can be a regular person outside of other things, but your role at Cincinnati State is to follow those guidelines, because they're in place to protect others. And, you know, it's not necessarily a place to not model, I think. You know, we can't expect students to do something we're not. And the better that we do it, the more often and more consistently, then the better we're modeling, in my
I,
opinion.
I totally agree. And to your point, I think that because there's not a lot of conclusive data out there, we don't really know. And I always think it's best to err to the safer side.
I agree.
And when we're in an environment where it's required and you know, good that we're all together for this class, you know, if you're in a face-to-face environment, if we're close, in it's best to err to that safer side of protecting others from potential
Yeah.
infection. And you know, our the CDC's asked us to do it, the governor's asked us to do it, and our place of employment has asked us to do it. And for me, that's good enough reason.
Yeah. Yeah. So let's get to some last minute things. So let's recap real quick. We've talked about the guidelines for C State generally, and then specifically we talked about the three main types of masks. We talked about laundering and sterilizing those, and I think we've exploited and or shared some of the commonalities or common myths that are kind of out there. I love that we've gone through talking about particle size. I think that's really important to understand. You know, as we evolve and get more data, it's important for us to understand that piece, because that might help me feel better about why I'm doing some of these public safety things on campus. But in addition to that, then you've given us some great information about hand washing and using our sterilization techniques. And I just want to know, is there anything that we haven't touched on that you'd really like to share with people with respect to what you do, what people should be thinking about, etc.?
I think we covered everything that I think was important for this piece. I would just encourage people to, you know, as a summary, uh, you know, I would encourage people to make sure that when you hear something, one thing, you know, that you don't take everything that's out there as conclusive,
Yeah.
because they're going to put information out as they get it, and it makes it sound so like this is the way it is. And so we always want to look at evidence, and we want to look at evidence over time for lots of people. And you know, that's not really happened yet.
Yeah.
uh, and
Yeah.
and certainly the other thing is, if you're in a high risk group, you want to be more diligent. If you're in a low risk group, then we should be trying to protect others from us being infected.
Yeah.
But, you know, we don't have to live our lives so worried about getting it if we're in a low risk group. You know,
Right.
we see these numbers spiking, and, you know, there's lots of reasons for that. Restrictions being lifted, increased testing, and people being non-adherent to the guidelines. But what
Yeah.
we're not seeing yet is the fatality line isn't really spiking up, which is a good thing.
Yeah.
And I will say too that, you know, there's a lot of hype about running out of ventilators. In Cincinnati, we are well stocked with ventilators, and we've not even come close to reaching capacity. There's plenty of ventilators right now. I mean, unless something changes, to go
Sure.
around. Even when we were at our busiest, at where I work, we had plenty of ventilators
Okay.
to put
That's
people.
really good for people to hear, especially with somebody who's in the trenches working right now in our county, in our area. You know, to your point, you can get really sucked into all the nationwide stuff and not have really great information about your local area. And so I think that's super important. And I really love the idea of thinking about our stressors and anxieties and reducing those. Again, I'm going to say structure and planning is, and maintaining perspective are the zoom out. These are the ways to really reduce your anxiety. So Mike,
Yeah,
I want to thank you so much for this
yeah.
talk. And I'm going to ask you a question. So if I could encourage faculty members and employees and others to send me questions, would you be willing to come back again and maybe do specific answers to faculty questions in another video, maybe?
Absolutely.
Great.
This has been
Well,
fun.
I'm so thankful. Mike, thanks so much for all of your help. And I think you've done a really good thing here to clarify a bunch of things that are swirling around us. And well, plus, you know, I just always like to see your smiling face. And I actually feel better talking to an expert. You know, I think it wasn't that long ago, I actually called you or emailed you directly saying, you know, tell me about this thing, you know. It's nice to have someone who is grounded and at the same time is knowledgeable. And I'm so appreciative that you took this time today. Thank you.
Oh, yeah. Well, thanks for having me. It was fun.
All right, we're going to sign off.
Okay.
So faculty, send me your questions and I will get them compiled and get back with Mike, and we can do a round two, a video of personal protective equipment with a respiratory therapist guiding us along. Thanks a lot. See ya.
Thank you.